years old man injured his ankle during playing football. On examination, he has tenderness over the both medial and lateral malleoli. X-ray demonstrate bimalleolar fracture. That means the medial and lateral malleoli, they both are fractured, and displaced distal fibular fracture. And also there is a fracture of the fibula at the level of the syndesmosis, and that means at the level of the joining between the tibia and fibula. It is the fibrous type of the joint. And there is medial malleolus with the talar shift. The ankle has been provisionally reduced and splinters in the emergency department. What is the most appropriate management? That means initial management is completed. What may be the definitive management? So we have to go for the definitive management. And here the findings again. Finding is the tenderness in the medial and lateral malleolar area, and on X-ray finding there is bimalleolar fracture, and there is displaced distal fibular fracture at the level of the syndesmosis. So, and medial malleolus with there is a talar shifting. So what may be the management? Here the options are application of external fixation device, application of compression dressing and physiotherapy, application of ankle boot, surgical fixation, and below knee amputation. To understanding this cause, first of all we have to know details about the Weber or Danish Weber classification of the fracture of the ankle joint. Here this area where the tibia and fibula are attached, they are known as the joint, which is fibrous joint, is the syndesmosis. So when the fracture occurs below the level of the syndesmosis, this is called the type 1 type of Weber classification, and at the level of the syndesmosis is type B, and the fracture which is above the syndesmosis, it is usually known as the type C. So let's see, this is the Danish Weber type of classification. They are classified in the A, B and C. In case of A, there is below the level of the syndesmosis, and when this is the above the level of syndesmosis, it is this type C, and when at the level of the syndesmosis, it is known as the type B. So type B at the level of the syndesmosis, when it goes below, it is A, when it goes upward, it is the C. And this classification is very, very important because they have significance in the management procedure. So in case of Weber type A, that means when the fracture occurs below the level of the when the fracture is the below the level of this when it occurs the below the level of the syndesmosis, then it is called the Weber type A, and only ankle boot is enough in this condition. So only ankle boot is enough in Weber type A fracture. In case of Weber type B, there is two important options. One is the ankle boot and another one is the operative fixation. When there is a less injury or single malleolus injury, or when there is the non-displaced fracture or small fracture or non-significant fracture, in this condition ankle boot is enough. But when there is displaced fracture, that means fracture is displaced, when there is a big or large fracture, when bimalleolar fracture, and when the ankle joint is significantly distorted, in this condition operative fixation is must. And Weber type C, it is always go for the operative fixation. So what is our answer? Our answer is the surgical fixation. Why surgical fixation? Because there is the both malleolar fracture, that means medial and lateral malleolar fracture, and tenderness and bimalleolar fracture. There is displaced distal fibular fracture, and there is displacement of the talus bone. So for this condition we should go for the surgical fixation, and it is the massive destruction or massive damage or massive fracture in the ankle region, and there is the shifting of the different bone and the displacement of the bone. So we should go directly for surgical fixation, because the conservative management, that means the plaster or ankle boot, they are not able to keep back the bones in normal position.